Hello and welcome to this presentation entitled The Prognostic Impact of Mental Illness Among Hospitalized Patients with Takotsubo Cardiomyopathy in Texas between the years 2007 to 2014. My name is Dr. Joshua Ronen. I'm a third-year internal medicine resident with Texas Tech University Health Sciences Center at the Permian Basin in Odessa, Texas. I'd like to thank Dr. Lavi, our Chair of Pulmonary and Critical Care Medicine, for his support and collaboration on this project. Takotsubo cardiomyopathy, herein abbreviated as TC, is a clinical syndrome characterized by transient myocardial dysfunction and can mimic acute myocardial infarction. Affected patients may become critically ill, requiring care in an intensive care unit. The mechanisms underlying TC are unclear but likely related to sympathetic activation, since most TC events appear to be triggered by physical or mental stress. Mental illness has been often reported in patients with TC as well. Pre-existing mental illness has been associated in the general population with short and long-term survival, in part due to cardiovascular disease, and with increased short-term mortality among hospitalized patients and among those with critical illness. The association of mental illness with short-term mortality among hospitalized patients with TC, however, is unknown. Moving forward to our methods section, our study design was a retrospective population-based cohort study. Our data source was the inpatient public use data file for the state of Texas. Our study population was all hospitalizations of state residents aged 18 years or greater with a principal diagnosis of TC during 2007 to 2014. Mental illness was defined by the ICD-9 code-based taxonomy of the Healthcare Cost and Utilization Project's clinical classification software, Category 5. We collected data on patient sociodemographics, clinical characteristics, use of left heart catheterization, percutaneous coronary intervention, ICU admission, hospital length of stay, total hospital discharges adjusted for inflation to the year 2014, and hospital outcomes. Multivariate logistic regression modeling was used to examine the association of mental illness with short-term mortality, defined as in-hospital death or discharge to hospice. Statistical significance was considered for p-values less than 0.05. Moving forward to our results section, there are 1,808 hospitalizations with the principal diagnosis of TC during the study period, of which 781, approximately 43.2%, had mental illness. The characteristics of TC hospitalizations with and without mental illness are detailed in the table to the rightmost portion of this virtual ePoster. TC hospitalizations with mental illness had a higher burden of chronic comorbidities than those without it, and had more commonly one or more acute organ failures such as respiratory or metabolic, respectively. Crude short-term mortality among TC hospitalizations with and without mental illness was 3.1% versus 1.6% respectively. On adjusted analyses, mental illness was associated with increased odds of short-term mortality, with an adjusted odds ratio of 2.80 at the given 95% confidence interval. In conclusion, our study represents the first population-level examination of the association between mental illness and short-term mortality among hospitalizations with Takotsubo cardiomyopathy in the United States. Mental illness was prevalent among hospitalized patients with Takotsubo cardiomyopathy, with those affected being younger, but with a greater burden of chronic illness and higher acute illness severity. Mental illness nearly tripled the odds of death among affected patients, even following adjustment for confounders. Our findings can inform physicians' decision-making and preventive care efforts. However, further studies are needed to elucidate the mechanisms underlying the adverse prognostic impact of mental illness in TC. Thank you very much for listening and tuning in to our presentation.